The NYPD's new homeless outreach initiative is seeing increased staffing and results.
More and more nurses are now riding along with officers, hoping to help in a number of ways. Jessica Layton shows us the work being done in a story you'll see only on 2.
On a rainy night, specially trained NYPD officers hit the streets to help the city's most vulnerable.
We just wanted to come check in on you, see how you're doing.
Approaching the long-term street homeless, not with handcuffs, but with humanity.
You can talk to us about anything. I swear, we would not judge.
Officer Vanessa Wanderling has been with the citywide mobile crisis outreach team since it started in 2019.
Ask them if they had any needs, whether that was medical or had they eaten today.
Where the unit goes is based on the public's tips to 311.
If we get a cluster of calls, that's an indication to us that, we want to go visit that area.
This time it's Wall Street and the Fulton Street station.
I want to see your arm and I want to see your foot.
Unique to this program, nurses who are paired up with officers. Richard Japatana carries gloves whenever he goes out.
We examine him, physically and mentally. We have a lot of individuals that we meet that they are really mentally sick, that they appear to be dangerous to themselves and others.
When this outreach program was created about a year ago, there were just 2 nurses. Now there are 24, and they're able to approach and engage the homeless in a way that those living out on the street may not have experienced before.
Once they understand, hey, this is a nurse here, and they start asking them, how are you feeling today? Do you have any issues that you would like me to address? You can see the homeless person is kind of surprised by that, and then they start talking to them.
Inspector Phyllis Byrne admits the biggest challenge is that many refuse help. What does it say about our shelter system when these men and women would rather be on the street?
It's a difficult situation to be in a shelter with a bunch of people that you don't know.
Oftentimes they feel unsafe.
But on this night, an older man wearing a hospital wristband and sandals who's been living in the subway finally agrees to go to a drop-in center.
I'm so glad you want to come with us.
What do you think it was that made him say, okay, I do need a shelter tonight?
I think he really did deep down want to have a place to go, and so he just needed someone to kind of coax him a little.
He may be 1 in 60,000 city homeless, but tonight he's one more that has a place to stay. Jessica Layton, CBS 2 News.
Last year alone, this outreach team was able to connect more than 200 homeless people with services, including shelters, drop-in centers, and hospitals.